Next question is actually two questions back to back, same person or combo. What is the view of the AC125 change after chemo as an indicator of chance of recurrence? And then followed up with what work is being done to increase the quality of the monitoring AC125 versus scan versus others?
So CA125 is a very good marker, particularly for high-grade serous ovarian cancer. About 85% of patients with high-grade serous ovarian cancer will have a CA125 as a pretty reliable measure of their disease. So usually it will be elevated when they're diagnosed. It will drop with their treatment and can frequently rise before you even see measurable disease at the time of recurrence. The good news about that is that you can save people from the exposure to lots of radiation by following CA125. We do that in a lot of patients who we feel have a very reliable CA125 marker, and then if the CA125 starts to misbehave or move in the wrong direction, we will then do imaging. So you can save people the radiation exposure. Many people, though, will realize we don't like to treat just the CA125 alone, that while it can be a hallmark of disease recurrence, you can get false elevations. I've had patients who've had the flu shot and their CA125 goes up. I've had patients who've had other things going on in their abdominal cavity, diverticulosis, and it goes up and then comes back down. So we don't like to treat it just based on it, but it certainly makes us be a little bit more, we sort of follow things a lot more closely when the CA125 is starting to misbehave. So there are, though, some serous, high-grade serous cancers, the low-grade serous cancers, the clear cell carcinomas, for which CA125 may not be a very good marker. And in those patients, you really then have to use imaging as a little bit more of your standard of care in terms of following patients. And what was the second part of the question?
I'm sorry. The second part of the question is, what work is being done to increase the quality of the monitoring of AC125 versus scan versus ...
Yeah. I mean, there's other things out there. I mean, people are saying, well, this might be more sensitive than CA125, and I'm like, I don't know that we need things that are more sensitive than CA125. Because right now we'll see patients who have CA125 elevations and have no measurable disease, and I've even had patients who've had a rising CA125 for more than a year before they develop measurable disease. So except for the anxiety part, we certainly don't want to pull the trigger too fast on treating patients based just on CA125, but it certainly is something for us that's a red flag of trying to be cautious about something happening.